Hi, this is Forrest Lightberg on the board of the Santa Barbara Response Network. I'm here today for this Monday Compassion Center live with an amazing community leader at the Santa Barbara County Behavioral Wellness. Her name is Suzanne Grimmesey, and if I didn't pronounce that correctly, she'll correct me in a moment. But she's the lead on the community wellness team, which is a collaboration of 13 mental health agencies, including the Santa Barbara Response Network, which was formed after the fires and debris flow incidents in Santa Barbara. So also with us is Gina Carvalho, who's one of the co-founders of the Santa Barbara Response Network. And so I'd like to give them a moment to introduce themselves here.
Well, thank you, Forrest.
Yes, my name is Suzanne. I work with the County of Santa Barbara, the Department of Behavioral Wellness. And I'm looking forward to joining together in a dialogue.
And so Forrest, we thought we would come together and launch for us our first May Facebook Live to really focus on mental health as we launch into May as a Mental Health Awareness Month. So we are all, as part of the community wellness team, behavioral wellness, SBRN, Glendon, all the agencies are wanting to really put out as much information, messages, places people can reach out for help, and really focus on mental health this month. And I thought the best person to have on the program to start would be Suzanne, who's really a central person in our community. And so I wanted to just highlight every aspect of mental health that we can in the conversation, and what we want to impart to people right now as they're isolated and wanting to possibly get some support and find out where they can get support. So.
Great. Yeah. Well, thank you so much for joining us, Suzanne. And first off, what issues or concerns are you seeing at Behavioral Wellness and with the community wellness team that you're part of with individuals and families at this time during the COVID-19 lockdowns, during the COVID-19 outbreak? What are you seeing?
Well, I think I'd start by saying whether it's broadly in the community or if it's within the Department of Behavioral Wellness or it's through the community wellness team, we are as a community in uncharted territory. We have not together gone through a pandemic ever before. So we don't have anything to compare this to. And I don't think it would be even possible to say that one group is affected, but another group isn't. I think we all are. I think people likely have a range of feelings, and what we've heard and seen reflects that. So feelings ranging from feeling anxious or fearful or frustrated or angry, lonely, even depression. And I think for many people starting to feel, if not already started, a sense of exhaustion, that this has really been going on a long time, and when the heck is it going to end? And I think probably what compounds the most is when those feelings of exhaustion start to hit. I think oftentimes that goes with feeling a loss of control. You know, there was a period of time where we heard that things might be closed and people en masse bought toilet paper and hand sanitizer and non-perishable foods, and they did all the stuff so they were ready. And here we are, and a week went by, and 2 weeks, and 3 weeks, and we're still going. And there are people I know within behavioral wellness, our services are still all available and all open, but for people with existing mental health challenges, I think this can be exacerbating. I think for people that live alone, it can be exacerbating. I know that there's people in the community that are living in unsafe situations at home, or children that are, and just waiting for these orders to be lifted. So we're seeing, I think, a little bit of everything.
Yeah,
sure.
I totally agree with Suzanne. Yeah.
Because there's the danger of the virus, but then there's also the collateral damage from what we've done in locking everything down, which includes mental health issues, domestic violence, child abuse, etc. And so the fact that you and so many other agencies are out there to help address that during this time right now, during this crisis, is so important. I think one of the reasons why we do these compassion centers is to let the public know as much as we can what resources are available right now. Anyways, so second question for you here is, what services would you like to highlight and share about, and how can people access those services? What services are relevant to this particular time for the public?
I'd love to answer that. So we have professional services, but this also goes to the conversation of how incredibly important, and we've always known this, connection is. We are humans and we're wired to be connected to others. This isn't a time that has to take that away. This is a time that strengthens that even more. And we've seen all kinds of creative ways that people have maintained connection, whether it's video chatting or Zoom or simply calling up the phone with intention and talking to someone that they haven't for a while. But as far as services that are available, so the behavioral wellness, the department I work with, everything is still available. We still have our psychiatric health facility or hospital open, our crisis stabilization unit. We have a sobering center. We have our outpatient clinics. We have our homeless outreach teams. We have our mobile crisis teams, safety for kids. That's all still there, with the addition that we have telehealth available also. So it gives an additional option, but the services are still there. And there's one number, the best number to call to reach to access services, whether it's for mental health or substance abuse related services, is our access line. It's open 24 hours a day, 7 days a week. That number is 888-868-1649. The other thing I would highlight is the community wellness team, which we started the conversation discussing. After the Thomas fire and the debris flow, we have a community full of people that help. Not a question of not having enough people wanting to help, but without being organized, it's not helpful. It becomes messy and confusing. So our helping people, we gathered together and we formed what we called the community wellness team. And it was over 13 different organizations. It gave us a whole continuum of care, from crisis counseling to first responder debriefings to community debriefings to long-term therapy, short-term therapy, groups, family work, all the way to the intensive outpatient program with Cottage Hospital. But we saw an interesting thing. After the community began to heal, that network, that community wellness team, stayed together tightly. And we've had many traumatic events that have happened since that time, and that team has been there for every single one. So now with COVID-19, that team has re-resourced itself so that everything is available virtually, which means now it's not just available for Santa Barbara, but countywide. So the services available are just the same: crisis counseling, individual, family, group, linkage to other services, just like we're doing right now, compassion centers, all of that is still there. And the number to call to access services or just to talk to someone is 805-364-2750. That number, as well as the access line, are both available in Spanish and English. So those are two of our local resources that I would highlight.
Yeah, and I really appreciate when Suzanne talked about how that collaborative. I mean, I'm on the phone, I know Suzanne is too, with people will call the line, the community wellness team line, with requests. I have this 13 or more people, over 20 people, I can text or call and say, can you help? I don't have to solve it. And I think Suzanne's vision and leadership in saying, we need to keep this going, because as communities, we get impacted by so many things. And to have something like this in place, and for SBRN to be part of that, it gives us, as people in the mental health field, our own support team. We have check-in calls in the morning. We ourselves I'm feeling supported by this group of, caring individuals. And I think that model that Suzanne's, articulating that the services are still there. We really want to get that message out. I think Suzanne and I are really clear that there are people there. You are not alone. These numbers and more that we're going to talk about, we're putting them on the SBRN Facebook page. They're going to be on the posting with this recording, so that all those numbers are available. Reach out, have a conversation.
Gina, if I can highlight, I'm sorry, Forrest, but if I can highlight one more thing that I think is really important. We talk in the mental health field about clients and people seeking mental health services, which I hope will always be the case. But I think what we're experiencing right now, there may be people out there that may not feel like they need to seek mental health services. They need money for their business, right? They may not feel like they have a mental health challenge, but they need to see their family. They're alone in a skilled nursing facility, those types of things. So I just wanted to say loudly that we are, as a community, we're stronger together, we're safely apart, but we are never alone. So it doesn't have to be a phone call reaching out for help, doesn't have to be based on a history of mental illness. It can be, but no one should be alone in this.
Mm-hmm. That's such a good, that's so valuable, because when, that's that stigma. Really, people might say, well, I'm going to be okay. I don't have, I'll ask people, how are you doing? Oh, I'm fine. But you're right. But there's other things on my mind, missing my grandchildren, in my case, missing certain people that I don't know when I'll be able to see. That makes me feel very sad. And I need to talk about it. And I feel a lot better when I do, and say, I'm really missing. I'm really feeling, it. And it often doesn't take much, but it makes a huge difference in my day. And that's what we're talking about.
So what would some of your tips and advice be right now for families and individuals who may be feeling overwhelmed or afraid during these times? Aside from the resources that we've been sharing about here, what are some strategies, some tips, some advice, some things that they can implement today to help cope, to help manage, to help navigate through this time as gracefully and healthfully as they can?
It's a great question, Forrest. The first one I would say that usually gets a laugh because it seems almost impossible right now, but is to keep routines. Well, yes, our routines have all been disrupted. So create new routines and then keep them. But to have routines in our lives, even if you're someone working at home with children, routines have gone out the window, but we need them. We all need them for our own structure, our children, our adults. So set new routines, new expectations in the house. Kids watch adults so closely, even if they're not doing it intentionally, they pick up on the parents' or the adults' energy. And so if parents are anxious, they're constantly watching the news, they're constantly talking on the phone about the worries and the dangerous and the virus, kids are going to feel anxious. So be mindful of that. And it's a lesson for ourselves as adults to take care of ourselves too, because that in itself is a helpful tip for how you beat stress with kids. Stress is very contagious, but other things uniquely for kids, talk about what's going on with kids. Don't feel like you have to talk about it all the time, but if they ask you a question, it's okay to talk about it. Keep kids connected to their own networks is so important. I have 3 kids, granted 2 are young adults. I thought online school learning, that's so neat. Boy, that's going to be easy. And it's not easy. It's not easy to not be with your friends. It's not easy to sit in a classroom and walk up to the teacher when you need help. It's not easy to not have your regular schedule of soccer practice. So help your kids to stay connected to their social networks, whatever and whoever they might be. Whatever your routine is that you've built, stick to that routine. Give yourself the reliability of knowing what is predictable and what you can rely on. And the same thing for kids as adults, take care of yourself. So get good rest, eat healthy foods. It's a great time. We're all home together more often to plan and prepare meals together. move your body, get outdoors. I'm loving seeing families go on family bike rides, and I'm seeing more now than ever before. And I think for adults, this tip, to adjust our expectations. So many parents now are home with their kids, newfound appreciations for teachers and schools, newfound appreciations for a lot of things, but a lot of extra pressure then is put on themselves to be like that, or to be a way that they think they need to be. They'll let those expectations go. Just let them go and go minute by minute with routines and appreciate some of the smaller things rather than the worry about the bigger things. And be sure to carve out time to play with your family, with your whoever you are that you connect with, but to carve that time out. Those are some of the tips that I think of.
Absolutely. Gina, how about
These
you?
are great, Suzanne. I was going to talk about the routine one. I think that's been one of the most important things for me personally, is I actually, the whole thing about get out of your pajamas and get dressed. At first it was like, oh, cool. But I'm actually finding that that's really important. And to make my bed and clean my place, and that marks the beginning of my day. And then for me, the fortunate thing about having these online yoga classes, which, yoga has been really important for me physically. I have back issues and for my stress, but being able to go online and do a yoga class in the morning, or to do an aerobics class. And I just stick to that routine. And I found it really makes a huge difference. And then to get out in nature. Nature is very healing if possible for people. And dropping the expectations. I think that when you said that, I think people have very high expectations of what they can accomplish and how they should feel. And I think that when the first program we did on the Compassion Center was about self-care, and we're taking the selfish out of self-care and saying that's really the first step, is taking care of ourselves so that we can be there for our families and our loved ones. So I don't see that as selfish. I see that as a necessity for me to be able to be present. So anything that brings me joy, inspiration, little websites I visit so I can get quotes or read something beautiful, feeding my spirit and my soul. Like Suzanne said, laughing and having some joy in my life, and to buoying the spirit. That's and staying connected with the people I love. So I would say that very much parallels what Suzanne was saying.
Years ago when I was going through a personal life crisis of my own, when I was in college, I had a teacher, and a lot of it had to do with some emotional issues I was going through at the time. And I had trusted this teacher and shared with her about what was going on. And one of the things she said was the most basic thing she could have said, but it was also one of the most helpful things that she could have said, which was knowing that it was a situation that was going to take time to navigate through. She looked at me and just said, hang in there. Mm-hmm. and that was so helpful to have that, just hang in there. And, for what it's worth, I just felt like sharing that now, because sometimes, at least in my experience, and I'm sure everyone can relate, there are certain situations that it's not feasible to escape from in the immediacy of the next few days or weeks. And hanging in there, I'm glad I did, because eventually that light at the end of the tunnel did come. And I was also talking with a friend of mine today who's a PhD in nutritionist, and we were discussing how just the belief that there can be a miracle can sometimes move things in that direction more. And I know for myself, some of the health issues I've undergone in my life, that somehow beyond the statistical probability of happening, that there was a healing. And I used to think it was luck, but I don't know if I believe it was all luck anymore, because at the time I really believed that there was going to be some miracle that was going to happen, that something was going to happen, and it did. So just that belief and just hanging in there. I mean, if I could chime in with any advice myself, that would be it. Mhm.
I think, that you said that so beautifully. It's the word hope. I was doing this program, and they were talking about hope. And when you're hopeless, that's really, it's like that not hanging in there, like to hope. We don't know what, we don't know what the normal will be, or where we're going to end up, and when. There's a lot of questions, but if we can hold on to some hope, we're going to get through it one hour at a time, one day at a time, and
Sure.
one friend at a time.
So as we go into May, Mental Health Awareness Month, what other messages would you both like to share with the community, with different families, as we go through this time together?
May is a special month for those of us that live in the mental health world, and probably for others too. But the reason it's such a special month is we get a chance to shout every day for a whole month all the stuff that we know is important, to destigmatize mental illness, to destigmatize feelings of depression and anxiety and things like that. And it's just a reminder as a community, and also stories like what you just shared, Forrest. We are so resilient as human beings, and we're adaptable. And we've never been through COVID. We've never been through a pandemic before, I don't think. However, we have had to totally relearn how to do things differently. And we've done so, and we've come out perfectly okay. So I see that now. But this month, every year, May is Mental Health Awareness Month, and there's a theme. And this year's theme is Express Yourself. And I love it. We started talking about this conversation of how creative people were doing things, setting up home office spaces, how they were Zooming, but that's what this month is going to be about. And so I've been so touched by one of the peer groups within my department where I work. Something they're doing is they are starting, and I hope anyone listening will help move this forward as much as you can, but positive messaging through sidewalk art chalk. Go outside your house, go to the sidewalk, and write a wonderfully positive message. Go as far as you can, both directions. Or go somewhere, don't go anywhere you're not supposed to, but go somewhere where someone's living alone, an older person, maybe they just come out to check their mail. Write them a special message there. Outside of Cottage Hospital, our heroes, anywhere. But to get this out there. So that's something that behavioral wellness, one of the many things we're doing this month to really highlight, is the positivity. And it doesn't matter if we can't physically be with each other all the time. None of that has to stop. In fact, it can be even stronger. So May is Mental Health Awareness Month. We know that the prevalence of people that struggle with mental illness within the nation is 1 in 5, invisible most of the time. So a reminder for all of us to be aware of that, to be sensitive with each other, to hold each other up, to remind each other to hang in there, to ask each other how we're holding up. We don't have to be good. We don't have to be horrible. How'd you do it today? How'd you get through this week? Just to be there and support each other. So I'm really excited about this month, just starting off, and a whole month that we get to proclaim this stuff really loudly every day.
Mm-hmm, mm-hmm. What also strikes me in this conversation is we're dealing with a pandemic that results in physical. It's a physical illness. It's a physical disease. It affects us physically. So I think more and more people are motivated now to engage in healthier lifestyle practices, diet, nutrition, etc. So I just wonder how that will translate into greater mental health eventually in our society, if collectively we start engaging more in better practices, or even hopefully best practices for our lifestyle. And how will that influence in a positive way the mental health, the climate in society? So
I love that. And I hope people will use, I know I have, and I know others have, but I hope as many as possible will use this as a time to reset. We don't have much of a choice, right? We have a lot more time to think and to realize what we don't have and what we do have. And with using that time to reset, and just like you said, Forrest, the focus on physical health, getting out and moving, eating well, we have so much opportunity for healing as a community, as individuals. It's exciting.
nice reframe. Silver lining.
Right. You know, one interesting thing that about mental health and services is the shift to telehealth. I think has made services more accessible to more people. The fact that, you know, and I think an outcome of this going forward is that people may be able to access services, you know, a little more easily, you know. So that's one thing I've seen happening.
For years to come, we'll see what I think the silver linings here. For years to come, they're going to be unfolding. It's not all going to show up when the lockdowns lift.
Yeah.
For years to come, there's going to be changes, and we'll see.
Yeah, exactly.
So great. Well, we are at our 5:30 time now. So if you both feel like this conversation is complete, then we can conclude. Do you have any last words here?
I think my last word, thank you so much for letting me be a part of this, and go art chalk your sidewalks. Let's get positive stuff all over.
Same here. Express yourself any way you can. And thank you, Suzanne, and thank you, Forrest, for being part of my community and part of my team. And thank you and anyone who's tuning in. Thank you very much for joining us.
Thank you.
All right. Thank you all. Be well and see you on Wednesday.